The most common complications in orthopedics in general are infections, blood clotting, and pulmonary embolism.
That's Dr. Max, a board-certified orthopedic surgeon in Puerto Vallarta.
You're always welcome to reach out to me. I'll always be there to answer any questions.
Want to know how he can help you avoid complications post-surgery? Stay tuned.
The most common complications in orthopedics in general are infections, blood clotting, and pulmonary embolism. We use some very special protocols to prevent those things. For infections, we follow very strict protocols of sterilization, and we have special physical barriers between areas so there's no cross traffic that could be contaminating the operating rooms. So we knock on wood, we haven't had infections in years. We do provide coverage with antibiotics when a patient's admitted. They get antibiotics and they stay on antibiotics during their recovery period. And then with the wound care, we have been very fortunate that we haven't had any infections in many, many years. Blood clotting can be another complication. We give patients anticoagulants so that they can stay on anticoagulants. When it's a major type of procedure, they need to stay on it for about a month. If it's not such a major procedure, 2 or 3 weeks is enough. And fat embolism, well, we haven't had that kind of issues because we study our patients, and when they're admitted, we run a series of exams to make sure that they're in pretty good health. And we also have a cardiologist that will check up on a patient who is maybe elderly, has some medical issues. So the cardiology will give us green light so that we can proceed with surgery. If for some reason the patient can't proceed with surgery, then we allow the cardiologist to complete the treatment, and then we reschedule the procedure. But many of our patients already can come down, have their surgery. A lot of patients are basically health patients, but they just have a bad joint or a bad back. When they go back home, the likelihood of developing a complication is we stay in touch with them so that they can feel free to contact us if they need to reach us. But we do provide patients with written report in English of what we did for them, and they can follow up with their family doctor or their doctor back at home for the aftercare. Now, with patients that have serious health issues, they need to get walking, but they are really overweight, or they have a lot of other medical conditions like diabetes and high cholesterol and high blood pressure that hasn't been really controlled. We suggest that those patients do buy something called complications insurance so that when they come down, hopefully they will not need to use their complications insurance, but if they do, they can use that insurance to cover for any medical expenses or hospital expenses to attend to their complications. So that's a suggestion we give to all of our patients. All our patients could purchase complications insurance, but mostly the people who have ongoing morbidities, those are the ones that really need to think about buying some extra coverage.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.